All right, and let's move on to atopic dermatitis, more well known as eczema. What are some of the biggest misunderstandings that you see about eczema?
Not all rash is eczema. First thing I want to say.
Mm-hmm.
Eczema definition is a rash that itches. That's it. That's the definition of eczema.
Mm-hmm.
Not all eczema is allergy eczema. It is characterized by dry, scaly red patches, usually involving the face, trunk, in front of the elbows and behind the knees. Much more common in kids compared to adults. Just because you have eczema doesn't mean it's allergies. It could be contact dermatitis, it could be stasis dermatitis, it could be neurodermatitis. So there are different types of eczema.
Mm-hmm.
But I will say allergic eczema is probably the most common.
Mm-hmm.
Different reasons why someone develops eczema. Genetics play a role, environment plays a role. As for the genetics, there is a mutation that's seen in almost 50% of the patients. It's called a filaggrin mutation. You can commercially test for it, actually.
Mm-hmm.
Environmental factors, allergies, of course, both foods and environmental allergens. Irritants, physical factors like cold, heat, sweating, all of these can worsen eczema.
Mm-hmm. So someone who has that kind of like mutated gene, but they find it harder than to find that relief than if someone who dealt with eczema because of like environmental factors.
Because you can't change your genes, right? So this filaggrin, it's like a glue for the skin cells. It keeps the skin barrier intact.
Mm-hmm.
With mutation, there's not much filaggrin in the system. So it leads to the breakdown of skin barrier. And then what happens? It leads to easier penetration of all the allergens and irritants into the skin. There's no way to correct the mutation, but yeah, it is. The prognosis is not as good in the patients who are positive for this mutation.
Mm-hmm. So with patients like that, would you provide like a kind of steroid cream, something more topical for them, or would they take something internally?
So the standard treatment for eczema is, again, it depends on how severe the eczema is. First thing is moisturization.
Mm-hmm.
I would say very aggressive moisturization. We have creams, we have ointments, we have lotions. I'm not usually a fan of lotions when it comes to moisture.
Mm-hmm.
You can tell is if you can pump it, it's a lotion. It's water-based. I generally recommend don't use anything that you can pump. Use something like oil-based, which comes in a jar, and you can just apply with your fingers.
Mm-hmm.
Ointments are more thicker than creams. Some patients don't like that.
Mm-hmm.
Make sure the moisturizer is fragrance-free. One of my favorite brands are CeraVe and Vanicream.
Mm-hmm.
There are emollients which soften the skin, like Vaseline, petroleum jelly, mineral oil, lanolin, and humectants, but we don't usually use it in eczema because they can be very irritating for the patient because of how thick they are.
Mm-hmm. And what would an example?
Sorry, go ahead.
Sorry, you said humectant. Is that what you mentioned?
Right.
What would be an example of that?
Urea, lanolin.
Okay.
But they're used for more severe conditions like psoriasis or ichthyosis.
Okay.
I prescribe them to my patients.